The allegations first came to light 2 weeks ago after a story from the Center for Investigative Reporting was published. It shows the number of opiate prescriptions at the Tomah VA more than quintupled from 2004 to 2012, even as the number of veterans at the hospital declined. News 8's Kyle Dimke sat down with the Tomah VA's medical director yesterday. He joins us now with more.
Brittany, the medical center director told me the Tomah VA knew about the rise in opiate prescriptions and conducted its own internal investigation because of it. He says the allegations made in the report only show data up until 2012. It doesn't show the progress that's been made at the VA since. Tomah VA Medical Center Director Mario DeSanctis says the allegations of overprescribing opiates made against his hospital are concerning, and he knows something needs to be done about it.
It says we definitely need to look at it and review our practices, again, to see if there are alternatives.
But even before an article from the Center for Investigative Reporting was released, the Tomah VA had already begun addressing its issues.
Many of the problems that were identified in those articles had been investigated, and as a result of those investigations or that investigation, we've taken, I think, many positive steps towards rectifying the problems that were found.
DeSanctis says following its own internal investigation, several different committees were put in place to monitor prescription rates at the VA.
In our approach to pain management, we instituted our Pain Management Committee. It's a multidisciplinary team of professionals made up of providers, nurses, pharmacists, to really review our overall approach from a multidisciplinary standpoint in taking care of pain.
The Tomah VA also created an opiate safety committee.
They meet weekly with the providers to go over veterans' care, to really look to see if we can taper off opioid medications.
The safety committee also gives providers targeted education on pain management and tries to find alternatives to opiates for pain.
There's a bright future for the Tomah VA. And the veterans want our care. We want to provide it to them. We want to be the facility of choice for veterans.
Now there is one more committee, a chronic pain management consulting group made up of pain management physicians and a person focused on opiate safety. Now this group works with not only healthcare providers, but also the veterans themselves to set up treatment plans and find alternatives to medicine like aquatic therapy and meditation.
All right, thanks, Kyle. Dr. David Houlihan has been reassigned and barred from giving out prescriptions until the investigation is complete. A federal investigation into the Tomah VA is expected to begin sometime next week.